So can physical therapy cause a migraine attack? And this is a question I get often in the clinic. And yes, it can happen, but it's not necessarily a bad thing. So hello, my name is Dr. Sam Kelakidis. I'm a physical therapist in Philadelphia, and in my clinic I focus on headache and migraine disorders. So today I want to talk a little bit about common reasons why your physical therapy sessions might be causing you to have a migraine attack afterwards, and then what you can kind of do about those things in working with your physical therapist. So I think there's 3 common reasons I see people have migraine attacks related to the sessions that I do with them. So one is that they were just going to have a migraine attack regardless of what they did that day. And that's because migraine is somewhat of an unpredictable condition, especially for those that are more chronic. When they come in, if they're already having 20 plus migraines a month and they're seeing me, they're more likely to have an attack anyway, and that's regardless if they did physical therapy or not. Another reason is that the stress of getting to performing physical therapy and leaving requires a lot of time, and that's additional stressors put on that person, and that might be pushing them over their migraine threshold. So planning the day, finding daycare, the drive, the physical therapy session itself, the drive back can just be a lot for some people. And if they have very low thresholds, I might be pushing them over it. So we might need to do things to modify that. And the last reason is that the physical therapy that we did, whether it was exercise or manual therapy or neuromodulation, was actually causing those migraine attacks to happen. So in this instance, we want to really figure out which interventions we're doing that are causing that. And really the best way to look at that is the closer you are to the physical therapy session to the attack, the closer in relation we can figure out which intervention it was. And then if the physical therapist is doing an exercise with you or some type of manual technique and that immediately causes an attack, we can more strongly associate it with that particular intervention. So here's different things you can do about trying to mitigate your risk for attacks related to some of the reasons I just talked about. So one is making sure you're planning out your day well and ahead of time as far as daycare and the commute, especially if those are known triggers for you related to like planning and cognitive stress. You want to also make sure that you're well hydrated before the sessions, you've eaten, and you're well rested. Because all of those things are known migraine triggers, so we want to try to mitigate those factors as much as possible. The other things we want to do is figure out, based on what you're doing in your physical therapy session, is what interventions might be setting you off. And some things we might do is we might do shorter sessions to start with and figure out how much you can tolerate that does not trigger a migraine attack. So it might be cutting back on the manual therapy or how aggressive somebody is with that or how intense or how much volume of exercise you are doing. So with a lot of my sessions, I might start out doing just a half hour with people and progressing up to that full hour session, depending on what those people can tolerate in each session. What I really find is really important is that we're always holding or having an open line of communication between me and my patient. And this is really important for, do they feel certain treatments are triggering their headaches? Do they feel like certain ones are actually making them less likely to have a headache afterwards? Are we noting that if we do relaxation afterwards that they're less likely to have an attack? If we do kind of like muscle relaxation or a session where we end with some type of calming intervention, is that helping them better get out of the process of having a migraine attack before it starts? And then we're really trying to plan around some of their other triggers. So if we know that them trying to come to the clinic is just too much of a burden for them, that we try to maybe find other solutions for them. So I also, for my clinic, instead of having people come to me, sometimes I do house calls because that just takes some of that burden off of that person of getting into my clinic. Other applications might be, if possible, if you're seeing a physical therapist where you live, is maybe options for telehealth as well. So that way we're reducing the burden of coming into the clinic, sitting in bright lights, especially if those clinics can't turn off lights and it's a big noisy room. So making those considerations to help really reduce your risk of an attack can be helpful for a lot of people. But the last thing I want you to take away is just because you have a migraine attack with physical therapy doesn't mean that physical therapy is a bad thing for you to be doing to help manage your migraine. It might be part of that course of care. What would be problematic is if you're constantly having a migraine after every single session and the physical therapist you're working with isn't listening to you and isn't modifying your plan of intervention.